So we go to next unit. Generally say that's poor slow development. In Chinese, we call 五迟五软. 五 is 5. 迟 is slow. So basically slow here, talking about body slow development. 五 still 5. 软 is softer or weaker. 5 different kind of slow and 5 different kind of weaker. So that's the translation for English here. Still means slow and still means weaker. Then let's see what kind of slow and weaker here. So 5 slow, 5 slow. The children standing slow, like the normal age. Other children can stand up already, but the sick children standing slow and walking slow. Other same age, they walking already. The sick children still couldn't walking. It's slow. And hair grows in slow. No hair. And the teeth coming out slow. And the speech slow. So that's 5 kind of slow here. So generally speaking, from these 5 aspects, like reflected of the children's how development. So generally say that means slow development. So children, possible slow development. These 5 slow usually coming together. It's not only one slow. Some people, like some children, they just walking slow, and then few years later or few months later, they can walk. But generally say the patient with these problems, they will have all 5 slow, all 5 slow. Then we talk about what is 5 kind of weaker. So basically weaker on the head and the neck. And weaker in the mouth, weaker on the hand and the feet, and including all the muscles. So that means whole body weaker, whole body weaker. So these illness mostly happens children under 3 years old. And especially like the parents can find the children have problems from 6 months to 1 year old. Before 6 months, like children didn't standing yet, didn't walking yet. So they may not find it, but they may have that trouble already. So generally we say find the problem from the 6 months to 1 year old. So that's generally speaking 5 different kind of slow and 5 different kind of weaker. So for the modern medicine, So modern medicine diagnosis, thus basically is infantile breathing disorder, still poor development. So that cause the symptoms like brain kind of damage and cause the body development is truly pretty slow or defensive or maybe damaged. So that maybe happens like a poor natural reasons, like a genetic reason, or maybe happens during the baby delivery, and maybe happens like after delivery. So that's the relationship with modern medicine. That's mainly motor function disorder. So that's basically for this illness. So we are talking about here, we are not talking about just the slow. It truly has some damage in the brain. For West medicine, that's the brain disorder. For TCM, we say kidney control the bone. For holding the bone marrow. And the brain is the seat of the marrow. So we say genetic problems, mainly relationship with the kidney. So that's mainly for TCM. But we still have different patterns for this illness. So the pattern, liver and kidney deficiency. So we say kidney is the mom of the liver. When kidney deficiency pretty easily causes liver deficiency. So that's we put together here. And the kidney control the bone, liver control the tendons. So people have walking problems, sitting problems. That's the relationship with the bone tendons and certainly relationship with the muscles. So general symptoms and signs, slow development, show up, slow sitting, slow standing, and slow walking. Compare with the normal children of the same age. So we have standard number. I didn't put a lot of detail on notes, but truly you can find on the book. So that's basically compare with normal children. They are slow. And so how slow is slow? Even they are 4, 5 years old. So normally children can walking around 1 years old, some slow, maybe 1.5 years. So generally 2 or 3 years, they totally can walk. But sick patients, even they 4 to 5 years old, they still not able to walk. And also like a slow development for the hair and slow development for the tear. So that's basically show up is kind of weakness and deficiency. So even with their neck dripping height means their muscles is weaker than. couldn't support their head, so they drooping. And even slow reactions, like you ask questions, pretty slow reaction or response. Even you just ask, come in, or look at me. They slowly turn over the head and then look at you. So that means pretty slow reactions. And also for fundamental. Fundamental, we say normally close time, the biggest one until fundamental, close under 2 years old. So they are still not close there. So that's we talking about the large fundamental even after delivery. And then slow development for the bone. So still have fundamental there over 2 years old. And the patient pretty easily got weaker and fatigue. And weaker the limbs. Restless sleep means they are not totally like got good sleep there. They always moving their limbs. And the body is smaller, thin and smaller building. Tongue is the defensive kind of tongue, tail tongue, defensive tongue. Pulse is defensive kind of pulse. Finger wing. Lighter color there means defensive. So that's basically clinical symptoms. We say we have 5 slow, 5 weaker. That's generally symptoms there. So treatment principle, certainly we need a tonified kidney and nourishing the marrows, nourishing the liver, stronger the tendons. I'm missing the treatment here. So basically we can do pretty similar treatment with last next pattern there. So gallbladder 34 is good. Kidney 3 is good. Also, you can add in liver 3. Yeah, liver 3 and south point of the liver. And we may changing spin 9 to spin 6 and stomach 36. So that's basically, and maxa, yeah, maxa. So maxa still help reducing with like a defensive kind of condition. That's so that's for this pattern. And some other 25 points, back rule still can use, yeah, back rule still can use. Like 人 points, you still can use 25 元气, like 人 6 or maybe 人 4, and maxa 人 8. And also people have weaker like ankle and knee. We can put some maxa in there. So that's generally we talked about for this pattern. Then we go to the pattern heart and spleen decrease. So these patients still have like a 5 slow, 5 softer, speech slow, mental slow, and also they may have some other symptoms. We talking about the first spleen. That's dribbling saliva. Saliva is the body fluid of the spleen. And also pretty weaker to like shrinking the milk muscle. That's the relationship with the spleen. And the chewing the food is weaker. Still need the muscles there. And the poor appetite, that's no relationship with spleen. So constipations, yeah, spleen defects usually cause like diarrhea, but we have one kind of constipation. Their stool still like moisty, it's not that dry, just difficult coming out. So that's still belong to deficiency, T deficiency. And also, yeah, and also people certainly have some other poor development here. The tongue usually is bigger. That's Qi deficiency, some body fluid, not the circulation there. And all may be pale, yeah, maybe pale with some teeth mark possible. Pulse is deficiency pulse. Finger ring is light color or pale color. So that's generally is mainly relationship with spleen deficiency. So because patient have speech problems, so speech function relationship with the heart. So that's why they tonify the spleen and nourishing the heart, and tonify qi and the blood. So the point here, yeah, the point here, we still use gallbladder 34 because that's mainly relationship with tendons and the people weakness in there. And we still can go to kidney points, yeah, south points, but we mainly tonify T and tonify blood. And we still can use maxa. Then we're talking about phlegm stagnation, or maybe blood stasis, yeah, phlegm blocking, or sometimes even can find blood stasis. So this pattern, yeah, this pattern, even more severe, yeah, even more severe. So we're talking about a walking problem before, standing problem before. We have all the 5 weaker and the 5 softer there, or 5 slow there, and with orifice problems, definitely. The infants or children couldn't hearing properly and couldn't speak properly and still slow reactions. Severe kind of case, unconscious. So truly this pattern is more severe pattern compared with last pattern. And still have movement problems, but they may have some involuntary movement, like a restless kind of limbs, and some dribbling and gurgling in the short air, and joints most deeply. It walking slowly and weaker, and also steep. Severe case or maybe scissors. We have a special class, specially discussed scissors. Scissors can cause by many reasons. And the tongue still lodging phlegm irritation there, and some dark red spots. That's the word. That's coming from stasis, blood stasis, and the greasy tongue coating coming from the phlegm. The pulse is deeper, means internal disorder. Choppy pulse usually coming from blood stasis. Sleepy pulse usually coming from phlegm. And the finger vein is dark, dark red or purple. Stasis there just means it's not truly to see clear, meaning it's more dark coloring. So that's the most severe kind of disorder during this like 五迟五软 5 slow and 5 weak. So treatment principle, we say clear up the phlegm and open the orifice because they truly have orifice problems. And moving qi, moving blood, open the channels. So these one even more like difficult to treat. So generally say we may need a combination treatment, TCM with West medicine, or maybe needles with acupuncture, marsupial, and herbs. So that's basically this one is pretty severe one. But generally speaking, we still can pick up some points like spin 10, bladder 17, moving blood, and stomach 40, spin 9, that's result phlegm. And stomach 36, generally qi 25. Still underlying body condition, still deficiency. It's mixed pattern, deficiency with excessive condition. So if especially dribbling west area, we can go to Sanjiao channel, especially treat that problems. So that's just the modifications here. So generally speaking, these problems mainly is genetic problems. If they have these problems just after delivery or maybe during the delivery, cause problems. It is long-term treatment will be needed. We can think about the brain damage, how severe it will be. I couldn't say like all acupuncture can totally cure the problems. But truly with acupuncture, with herbs treatment, even with modern medicine treatment, can guide some symptoms, getting like less and less, and can get some benefit from it. And also, for these kind of children, need function training. We're talking about people walking slow and standing difficult. So that's truly kind of muscle weaker, tendons weaker. So we can give patients special kind of training. So that's that kind of training basically in like improve the physical activity and skill. So even for Western medicine, even for Western medicine, we talking about the brain damage. Thus, basically, we have motor function there and the sensory function. So basically, these infections mainly is motor function. Sensory function still kind of damage there, but look like it's not that clear damage people's life. But motor function damage there, children couldn't walk. So basically, we training mainly for motor functions. And also, if patient has speech problems, we especially need training for speech problems. So that's basically need a long-term, like a function kind of training, both for the body, physical skill, and for people, like the speech functions. And then recover mainly some motor functions and recover normal like the nervous system reflections. That's by the modern medicine aspect. So for TTM, we talk about tonified body density and against the passenger. So even genetic problems is difficult to treat, but after some treatment, still can get some degree kind of improvement. So that's physical training is very important. Is very important. Not only for these problems, not only for these problems. I think you have heard some people like by accident, they injure their vertebral column and then they couldn't walk in. Like hold the leg is weakening. Pretty similar in internal medicine, we talk about weight syndrome. Weight syndrome is muscles weakness. So these kind of patients, if you are not training for them, they will be getting weaker and weaker and weaker in the muscles. They will never work walking anymore. And their muscles, their legs, basically will go to thinner and thinner. No muscles there. So if after training, they can recover some functions of the muscle or motor function. And some special case, some people after training, they can walk in by themselves. So physical training is pretty important, especially for these kind of cases. But truly need a pretty longer time, like we calculate by years. Yeah, it's not just a couple days or even just a few months. But you can gradually find the like a patient getting little bit better and better. But truly need a long-term treatment. Prevention. So generally we're talking about these problems, maybe genetic illness. So basically, right now we can test for DNA. If and the patient have history about the genetic problems, and then test for DNA. If find some like the same sick genes in there, so basically it's better to end. Yeah, it's better to end. Otherwise, it's sadness for the children for the whole life. So that's why we're talking about terminal of the pregnancy. look like sad in that moment. But you can think about if just baby have severe kind of disorder, even after delivery, it's not only sad for the parents, also sad for the children. And the parents need a whole life to take care of the children for severe case. So that's basically if we truly find the genes disorder. And also for pregnancy. Pregnancy mom need to keep healthy. Then babies will be healthy. So not big emotions, not like smoke, not drink alcohol. So basically keep mom healthy and give enough nutrition, then the baby will be healthy, including get some sunshine and try not to use the drugs. So truly, when like a mom getting sick, maybe need drugs, but depending what kind of situations. We talking about go back about 50 years ago. It's like 1960. During that time, in the United States, a company development a new drug. So this is not only one drug, it's a kind of category drugs in there. But these drugs, the functions mainly relieve the symptoms, morning sickness for the pregnancy. So we know when people get pregnancy, like early, usually start from some people getting let it be early, some people let it be slow. Generally say pregnancy 2 to 4 months, like the people, especially happens in the morning time. So that's why we call the morning sickness. Nausea, vomiting, and couldn't smell like a food smell or other smell, and abdominal distension. So that's some severe case, nausea, vomiting. Yeah. So even couldn't take the food. When they eating, they vomiting out. When they drinking water, they vomiting out. So that's the kind of for some pregnancy women, it's kind of severe kind of disorder. For others, maybe not that severe. So that's during that time, a new drugs is be funding or development. Then lot of pregnancy women take that drug. So truly they relieve the symptoms, morning sickness. They are not vomiting again, and they can eating, look like healthy. But after the baby delivery, lot of like the baby, they have the trouble. They may have 6 fingers there, and they may have like a heart disorder there. They may have multiple toes in there. So truly, it's not only a couple of the like a baby have this trouble. And the research found all the baby have that trouble. During that time, their mom take that special kind of drugs, try to reducing the symptoms, morning sickness. So that's directly relationship like get a baby, some poor natural problems. So from there, from now, That's we are not use that kind of drugs anymore. And for TCM, we say that kind of drugs kind of like a toxin for the body is truly damage key of the liver. So that's another aspect we need to be careful. During pregnancy, try not to use any kind of chemicals, including some drugs. And certainly we need to see, like if truly pregnancy mom get a pretty severe kind of emergency kind of situation, like a blood pressure suddenly rushing up to 200, that kind of emergency, we still need to use. Yeah. We still need to use the drugs or medication. But just generally say, if not necessary use, try not to use. But still to see which side is more severe and disorderly. And also we're talking about we encourage the mom breastfeeding for the baby. So basically, the mom's milk, they have a lot of like nutrition, including hemoglobin. That's basically our immune system's protein. So that can protect the baby for preventing some illness. So it's better breastfeeding the baby. And also when mom holding the baby, like for the babies, is feel more safety there. And also we talking about the physical exercises for the pregnancy mom and also for the baby. For the pregnancy mom, not overdo it, but still need some movement, yeah, like walking, like walking. For the babies, still by the age, and we do some like a suitable kind of physical exercises for the baby. Then we talking about the nurse care. So these illness we still say is pretty difficult problems and mainly relationship with differences. So that means the baby need more nutrition to build up their body. So find a suitable kind of food for the nutrition and easily digested. And these problems we talking about is long-term problems, chronic problems. We help the baby for training, including physical body training and brain training. And also, yeah, we're talking about acupuncture here. Also massage, yeah, especially Tuina massage can help recover like some function of muscles and especially preventing muscle atrophy, like we talked about the shrinking muscles before. So that's basically for this